All right, good morning, everyone. I am Santa Clara County Supervisor Susan Ellenberg and President of the California State Association of Counties, CSAC. The entire county family is here today. With me are representatives from the Urban Counties of California, UCC, the Rural County Representatives of California, RCRC, County Welfare Directors Association, CWDA, County Health Executives Association of California, CHIAC, California Association of Public Hospitals and Health Systems, CAF, County Behavioral Health Directors Association, CBHDA, and the County Medical Services Program, CMSP. And we are all here today united with one message. California's communities cannot wait any longer for the state to respond to the threat posed by H.R. 1. Behind me are county supervisors and leaders, again representing counties and public health systems from every corner of the state, urban, suburban, and rural, red counties and blue counties. We are united because the consequences of inaction will be felt in every single county. That is because H.R. 1 shifts billions of dollars in federal costs to counties without eliminating any mandated requirements. In fact, it adds more. Counties are on the front lines. We provide health care, behavioral health care, food assistance, child welfare, homelessness prevention, and public safety as directed by state and federal law. When people are in crisis, counties are the ones who answer the call. So we are calling on the state to partner with us to stabilize these systems before families are harmed. But the scale and urgency of this crisis has not yet been met with the action Californians need. Last week, the governor released his May revision budget proposal. It does not include any funds for the state's mandate to counties to provide indigent health care in their communities. Does not provide any funding for public hospitals, the hospitals that provide more than 50% of trauma services and 50% of medical residency programs across the state that will experience significant cost pressures. And only a fraction of the general fund support needed to keep eligible Californians from losing their health care and food support. We estimate H.R. 1 will cost California counties up to $9.5 billion every year. I'll just say that number again, $9.5 billion. But we know the political reality that we live in, and we are asking for a fraction of that. $1.1 billion in the upcoming budget deal and $2.5 billion in the next fiscal year. And the May revise still comes nowhere close. It funds just $87 million for this year and nothing for next year. Nothing. That is just not acceptable. If the state fails to act now, the impacts will be immediate and devastating. Longer emergency room waits, reduced access to care, more people cycling through behavioral health crises without treatment, more families unable to afford food, and a deeper strain on local governments already stretched to the breaking point. In my county, Santa Clara County, the stakes are enormous. We receive about $3.5 billion in federal funding every year. More than $2.3 billion of those dollars supports Medi-Cal alone. Nearly 465,000 residents rely on Medicaid for health care, and more than 133 residents in my county depend on CalFresh to feed their families. Santa Clara County also operates the second largest public hospital system in California. Our hospitals serve everyone, regardless of insurance status or ability to pay. That includes emergency care, trauma care, burn treatment, and cancer services. Counties cannot and should not be expected to absorb the impacts of H.R. 1 alone, and Californians cannot afford the delay. We call on the governor and the legislature to move with the urgency that this moment demands, to stand with counties to protect the essential services millions of Californians rely on every single day. For a little bit more, I'd like to turn it over to Monterey County Supervisor and CSAC First Vice President, Luis Alejo.
Thank you very much. Thank you very much, Madam President Ellenberg. It's a beautiful day anytime I can stand here with county supervisors and county leaders all across the state of California. I'm Monterey County Supervisor Luis Alejo, and I'm here today because counties across California are facing a crisis we simply cannot absorb on our own. H.R. 1 would rip billions of dollars out of California's safety net and shift those costs directly to our counties, the very governments on the front lines serving our residents every single day. And counties have come forward with real solutions. We have asked that the state partner with us before these cuts devastate our local communities. But the response so far has not matched the urgency or the magnitude of what is coming. If action is delayed, counties will be forced into impossible decisions. Do we cut healthcare services or sheriff deputies, food assistants or election workers, behavioral health programs, or the frontline staff working every day to address our homelessness crisis? And when services are cut, it is not abstract. Real people pay the price. Working families, our seniors, veterans, farm workers, children, residents already struggling with the high cost of living in California. In Monterey County alone, more than 51,000 residents rely on CalFresh to put food on the table. Across Monterey, Santa Cruz, and San Benito counties, an estimated 41,000 people could lose their Medi-Cal coverage. And let's be honest about what these policy changes really mean. More frequent eligibility checks are not about accountability. They will simply push eligible working families off health care and nutrition programs simply because county systems and staffing are already overwhelmed. Our county eligibility workers will fight every day to keep people enrolled, but they are already stretched thin, trying to serve thousands of residents with dignity and urgency. And when people lose their health care coverage, they do not stop simply getting sick. They wait longer, conditions worsen, and eventually they show up in emergency rooms in crisis when treatment is much more expensive, more difficult, and sometimes too late. Counties are legally and morally required to provide care of last resort, what we call indigent care. Yet counties still haven't been made whole after the redirected critical health care funding during the implementation of the Affordable Care Act more than a decade ago. The impacts will also hit our public hospitals especially hard. In my community, Natividad Medical Center in Salinas is not only our state's oldest public hospital, but it is a lifeline for the entire region. Natividad provides level 2 trauma care, emergency care, and treatment for everyone who walks through its doors regardless of insurance status or ability to pay. As federal funding shrinks and uncompensated care rises, public hospitals like Natividad will be pushed closer and closer to the financial edge. Yet counties will do everything within our power to protect our residents because that's what we do. But we cannot carry this burden alone. This moment is a test of California's values. We can follow the path of turning our backs on our vulnerable residents as being directed from Washington, D.C., or we can step up together to protect the communities we were elected to serve. The decisions made in the coming days will determine whether millions of Californians continue to have access to health care, food assistance, or basic stability. We cannot afford to get this wrong, everyone. With that, I will now turn this over to my colleague, Colusa County Supervisor and CSAC Second Vice President, Ken Bowes, to round us out. Ken, please.
Thank you, sir. Good morning, everyone. Thank you, Supervisor Alejo, and thank you, everyone, for being here today. I am Colusa County Supervisor Kent Bowes, and I serve as CSAC's Second Vice President. I want to start by saying that H.R. 1 is not some abstract policy debate that only affects people in Washington. This is real. This is not red. This is not blue. This will affect every community in California, including my rural district in Colusa County. Almost 80% of the residents in Colusa County rely on some form of subsidized health care, With H.R. 1, we are estimating that 30% of our Medi-Cal enrollees will fall off the rolls. Not because they aren't working, not because they aren't eligible, just because that's how H.R. 1 was written. Our hospital, Calusa Medical Center, depends on Medi-Cal reimbursements to keep its doors open. And if thousands of residents lose their coverage, it creates a very real risk that our hospitals could shut down. Our hospital, excuse me. And that affects everyone. We only have one hospital in our county. We cannot afford to lose it. If it closes, residents would have to drive to Marysville for the nearest hospital, up to 45 minutes away. And that's from the center of the county. So on the outskirts, it's even further. In other parts of rural California, that drive is even longer. Across California, healthcare deserts are growing. 12 counties, including mine, no longer have labor and delivery units. Imagine having to drive up to 4 hours. Let me say that again. 4 hours to reach the nearest hospital while you are actively in labor. This reality is one that many families are facing today. And the impacts of those cuts go far beyond healthcare. When people fall through the cracks in the safety net, counties are the ones that have to respond. That means counties are forced to stretch already limited local resources even further to cover emergency services, hospitals, and public health needs. And when that happens, funding is diverted away from other essential county services that are already under strain. Public safety, elections, transportation. Those are just a few examples of services that will be cut if the state does not step up. Counties are on the front line of delivering these services to residents, and we deliver them on behalf of the state. And we call on the governor, and we call on the legislature to partner with us to protect California's safety net. I look forward to collaborating with the legislature, and I look forward to collaborating with Governor Newsom. With that, I'll turn it back over to Supervisor Ellenberg for questions. Thank you so much.
Thank you all. It is no coincidence that the 3 CSAC officers are always represented respectively by urban, suburban, and rural counties. We are all in this together, and we are all making these asks as one. We're very happy to answer any questions or welcome you to do individual interviews. I think additional revenue is a valuable option. It's not soon enough, it's not dependable enough, and we don't know that it will come directly to counties. So while it may be overall beneficial, it's not clear that it addresses the H.R. 1 crisis. Do you want to add more?
Thank you, Madam President. I'm Graham Canals. I'm the CEO of the California State Association of Counties. We need to be very clear about the revenue that was proposed in the May revision. $21 million would be discretionary revenue that would have some potential to work towards H.R. 1 as a solution. $21 million. What we're talking about is up to $9.5 billion in reductions to our ability to deliver services on behalf of the federal and state government. $21 million isn't going to get us there. So let's be very clear. That proposal may have lots of merit in other spaces. It does not address this problem at all.
Okay, if there aren't other questions for the group, we are happy to talk with any of you individually. Thank you again very much to all of the media for coming out today and for helping us make our message heard across the state. Thank you. Sure, supervisors, everybody back here, stay right there.
Get small. Well, come out in front of me. Come here.